During recent times, and somewhat attributed to the COVID-19 pandemic, awareness of mental health in professional football players has become a discussion point. Data released by the Professional Footballers Association in May 2020 revealed that from the 262 members surveyed between mid-April and mid-May 2020, 22% of members revealed that they had had feelings of depression or had considered self-harm. Furthermore, 69% of participants suggested that they had become worried about the future of their careers, such as being out of contract, with 72% regularly reporting nervous or anxious feelings and 9% revealing that they may have had some issues with addiction. A 2018 review of the Mental Health Act was conducted for the UK government under the guidance and direction of Sir Simon Wesley. It was concluded that whilst there were various societal trends within the domain of mental health, sport is integral within society, and professional sport be considered a social and cultural subset. Therefore, Wesley suggested that those involved in elite sport should give special consideration in the future creation of policy. In June 2022, the World Health Organization released its largest review of global mental health since the beginning of the centuries. Their figures suggest that in 2019, 1 billion people were living with a mental health disorder and 14% of the global adolescent population, with reported cases of depression and anxiety increasing by more than 25% in the first year of the COVID-19 pandemic alone. Mental health awareness in elite athletes has become prominent in recent times, and this has been highlighted by the 2019 International Olympic Committee's consensus statement on mental health in elite athletes by Reardon et al. Their suggestion that mental health is integral to both well-being and performance, that it cannot be separated from physical health. While it is common practice within sport to monitor, mitigate risk and manage physical injuries within elite athletes, there is much less of a research emphasis on the psychological well-being of high performers. Thus, it has been postulated that due to the wide number of stressors encountered by elite athletes, this population may be further at risk for poor psychological well-being and much higher mental distress. It's worth distinguishing that there is a difference between mental health, which is something that we all have, and common mental health disorders, and indeed mental illness. Typical symptoms of common mental health disorders are those of anxiety, depression, and adverse substance abuse. As stated by the World Health Organization, a mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. Previous literature has indicated that whilst elite athletes may experience mental health disorder symptoms comparable to the general and non-athletic population, they are also susceptible to further organisational and professional stresses that may be unique to their elite or professional populations and domains. These stresses that are not commonly associated in the general population may be injury, social media issues, or the sudden end of a career in retirement or transition out of their sport. While guidance on the optimal ways of mental health promotion in elite sporting environments is increasing, there is still a lack of validated screening tools within the athletic population to assist in the early detection of psychological distress. Early literature by Arnold and Fletcher in 2012 actually identified 640 distinct organisational stresses on elite athletes. And what is not known is when these stresses actually occur and whether elite football players experience psychological distress within a football season at key points such as fixture congestion at Christmas and Easter, or due to other factors such as transitioning out of the sport, contract negotiations, or injury and illness. In elite sporting environments, professional athletes may not seek out the support required for mental health issues. This may be due to stigmas or the idea of not being selected for their chosen sport. However, in professional football, the stressors leading to common mental disorders such as anxiety, depression and substance abuse may be multifactorial and not a singular entity. Outside of the biological, physiological and social stressors, previous literature has demonstrated that there may actually be football-specific stressors that compromise the mental health in professional football players. Furthermore, these football-specific stressors can be divided into 4 categories: leadership and colleague issues, logistical and environmental issues, cultural issues, and performance issues. And these were identified by Gouttebarge et al. In 2018. A review by Kuttel and Larson in 2020 posited that 81% of publications on mental health in elite athletes were between 2013 and 2018. However, there is still a paucity of literature regarding the common mental health symptoms in elite athletes, especially in elite football. What is less known is when these symptoms occur and when they are manifested. In a cross-sectional study in 2015 by Gouttebarge et al. In 224 Australian athletes, it revealed that 45% had experienced either anxiety, depression or psychological distress in the preceding weeks, with athletes who are injured demonstrating high depressive symptoms and anxiety disorders. Subsequent research in Gaelic football and hurling has revealed that a prevalence of symptoms of common mental disorders ranging from 48% for anxiety and depression and 23% for adverse alcohol use. This 2022 study by Gouttebarge et al. Also revealed that 68% of Gaelic players had a full-time job, which may or may not have influenced their findings. Whilst there is significant literature from epidemiological studies on the physical health or injury of players, there's very little information on the mental health and well-being in players, both in male and females. Early research by Gouttebarge et al. In 2015 has suggested that there may be a prevalence of common mental disorders, distress, anxiety, depression, and disturbed sleeping, and adverse health behaviours such as alcohol, tobacco use, and poor nutritional behaviour. Most symptoms of common mental disorders were found to be statistically significant in those players with severe injuries and career dissatisfaction. However, it should be noted that due to the cross-sectional design of this study, it's really hard to draw causal inferences. Currently, there is also a lack of researches on the experiences of mental health within a rapidly growing women's game. Recent literature from Perry et al. In 2022 explored the prevalence of common mental health disorders and eating disorders in the Women's Super League and Women's Championship. The authors suggested that the prevalence of moderate and severe depression at 11.2% was similar to female players in Australia and Switzerland, and moderate to severe anxiety at 11% was higher than players in Germany, Australia and Switzerland. However, as noted by the authors, this might be due to the data collection period, which was during the COVID-19 pandemic. In the same study though, 86% of WSL participants indicated that they felt they either wanted or needed psychotherapeutic support during their career, which is double the amount of German and Swiss female players. Furthermore, only 28% of WSL participants reported receiving psychological help from their clubs. 38% received help outside their club, but 50% of participants stating that they have access to psychological support at their clubs, leading the authors to suggest that whilst players want access to psychological service, many are not utilising it. However, just because we tell someone to seek help doesn't actually mean that they will. Research published by Young et al. In 2016 investigated the prevalence of depression and anxiety in elite male, female and under 21 players, suggesting that whilst male and female players had depression and anxiety scores similar to the general population, the under 21 player scores were significantly higher. This leaves potential gaps within the current literature as to when these symptoms occur and how we can acquire new knowledge to further ensure that elite professional football players are given the care required to perform at the highest level and maybe prepared to transition out of the professional game or with severe injury. This may give scope to further longitudinal studies to determine the potential cause and effect of common mental disorder symptoms in elite players. However, there may be some barriers to undertaking this research. Recent literature has suggested that organisational culture within elite sporting environments may view mental health issues as a weakness and not part of the high-performance day-to-day climate of which the players operate in. It has also been suggested that the attached stigma to mental health issues and help-seeking behaviours that may have actually led to the under-investigated and under-reporting of issues around this area of mental health in elite sport. In a 2021 narrative review of theoretical perspectives, Lundquist and Anderson suggested that much of the research on mental health concerns has been a shotgun approach with quite a wide variety of screening instruments being used within the literature and research. And this poses a problem too. The authors also make the suggestion that there is scope for more qualitative research designs to really understand the real world and lived experience of the athletes, which may give us greater insight into what the mental health risk factors may actually be. And this is supported by the recent work of Perry et al. Within the women's game, who suggest that not only do we need further research, we also need to understand the real life mental health experiences of the players so that we can help and support them within their careers. So where are we now? Well, as suggested by Lundquist and Anderson, mental health is an incredibly complex construct, and due to the nature of this, it's unlikely that we'll find consensus on a single definition within elite athletes. While it's been difficult to fit all of the research into this video, mental health in elite athletes and professional football still requires further understanding in key areas such as the stressors behind common mental health disorders, cause and effect, education of key stakeholders within football, and identifying risk factors and those who are potentially at risk. Much of the research within the mental health literature in football has been observational and or cross-sectional by design. Whilst this isn't necessarily a bad thing, it does make inferences into cause and effect very difficult. However, this research, or this type of research, does give insight into common mental health disorders in football and can be built upon to increase our knowledge and awareness of this really complex construct. As suggested by Altmans et al., studies making comparisons of common mental health disorders between elite athletes and the general population may require control groups to increase the validity of this research. So I hope you've enjoyed this small snapshot of what is really quite a complex area. And you can find all the papers from this video and some more further reading in the comment section. But it's also important to stress that while good mental health is paramount for us all, it is a very complex construct and depends vastly on the individual. So a one-size-fits-all approach may not be the best one. If you are struggling, please seek help from a qualified mental health practitioner.